So we were discussing antibiotics for pneumonia in children. The antibiotics are same, that is amoxicillin, clarithromycin, and doxycycline. Remember that doxycycline can be used in children who are 12 to 17 years old. In children who are less than 12 years old, clarithromycin is used if the patient has allergy to penicillin. Again, if the signs and symptoms are severe, then we'll use co-amoxicillin along with erythromycin. So double antibiotic for severe signs and symptoms and single antibiotic for mild diseases. And the first choice will always be amoxicillin. So three drugs that can be used in the management of pneumonia in adults and in children as well. And these three include amoxicillin, clarithromycin, and doxycycline. And in pregnancy, erythromycin as well. Discharge criteria and when to discharge a patient with pneumonia from hospital. The patients are not routinely discharged in the past 24 hours. They have had two or more of the following findings. So if any of these two findings are present, then we will not discharge the patient. Otherwise, we'll discharge the patient. What are these criteria? Systolic blood pressure 90 mmHg or less, oxygen saturation 90 or under 90, abnormal mental status, inability to eat without any assistance, temperature is higher than 37.5, respiratory rate 24 or more, and heart rate 100 or more. So any of these two, if they are present, then we will not discharge the patient. Now, there's a common complication of pneumonia, that is empyema. What is empyema? Empyema is collection of pus or pus in the pleural cavity. Empyema is a typical complication of pneumonia, but empyema can also result from chest trauma, esophageal rupture surgery, or chest tube insertion or thoracosynthesis. So we have discussed air in the thoracic cavity, and the causes of air in the thoracic cavity are also discussed. Now, if there's pus in the pleural cavity or thoracic cavity, then it is known as empyema. It is a complication of pneumonia. It can also result from chest trauma, esophageal rupture surgery, chest tube insertion, or thoracosynthesis. How you are going to know if the person has developed empyema in a person with pneumonia? How we are going to tell if he has developed empyema? If a person with a history of pneumonia and his symptoms are not improving with antibiotics, and he has developed swinging fevers or high grade fever along with night sweats and weight loss and chest pain, then you should suspect pleural empyema. So hints for pleural empyema is pneumonia is not improving with antibiotics, and the person has developed swinging fevers, night sweats, weight loss, and chest pain. So if you are suspecting empyema, what will you do? You will do pleural aspiration. We will aspirate the fluid that is, or the pus that is present in the pleura, and send it for culture and microscopy. So pleural aspiration is an investigation that is done in case of empyema. Aspirate the pleural fluid and send it for culture and microscopy. And if empyema is large enough that it is causing shortness of breath or respiratory compromise, or if the pH of the empymal fluid is less than 7.2, then we'll put a chest drain to drain the fluid that is present in the pleural cavity. So if air is present in the pleural cavity, a chest drain can be put. If fluid or pus is present in the pleural cavity, then again a chest tube will be placed. And what is the criteria to insert a chest drain in case of empyema? If empyema is causing respiratory compromise, and the second one is if the empyema pH is less than 7.2. So remember these two criteria to put a chest tube in empyema. The investigation that is done is a pleural aspiration and send it for culture and microscopy. How, when will you suspect empyema, pleural empyema? If a person pneumonia is not resolving with antibiotic treatment and he has developed swinging fever, night sweats, weight loss, and chest pain. Management is simple: pleural aspiration and send it for culture and microscopy. And if the pH is less than 7.2, or if the fusion is causing respiratory compromise, then we will put a chest in drain. Remember that antibiotic such as clarithromycin, which is used in the treatment of pneumonia if someone is allergic to penicillin, clarithromycin can cause rhabdomyolysis, and statins, they can also cause rhabdomyolysis. So if a person is taking statins and he is allergic to penicillin, then we cannot give him clarithromycin, because clarithromycin and statins, they cannot be taken together. So in this case, what will you do? We'll give the third antibiotic that we use in pneumonias, that is doxycycline. Remember that in the first patients who are allergic to penicillin, they are allergic to cephalosporins as well. So that's why we avoid cephalosporins in people who are allergic to penicillin. And we use clarithromycin in people who are allergic to penicillin. But if the person is already taking statins, then clarithromycin can also be not used. So we'll use doxycycline. So now again, a division of some differentiating points of pneumonia caused by different organisms. Herpes labialis, streptococcal pneumonia, erythema multiforme. So mycoplasma causes atypical pneumonia, that is dry cough and bilateral patchy consolidation. And other point for the diagnosis of mycoplasma is erythema multiforme. Erythema multiforme is, as its name indicates, erythema is redness or rash, multiform, that has many shapes or multiforms. Erythema multiforme is a target lesion of different shapes and forms. So someone with the cough and fever and target lesion on hands or on body, then you will think of mycoplasma. So this is another important point that you need to remember for mycoplasma pneumonia. A patient with HIV and CD4 count is less than 200 and he desaturate on exercise, hemosis is high, or carinae pneumonia. Pneumonia that occurs after influenza is Staphylococcus aureus. Now some more points for Legionella pneumophilia. Legionella pneumophilia causes atypical pneumonia. It also causes bilateral consolidation. These features are common to mycoplasma and Legionella. Then what are the differentiating features for Legionella? Legionella is commonly present in the water sources or water tanks. So a history of exposure to water, hyponatremia, and lymphocytopenia. If these features are given in the history or on the investigation findings, then your answer should be Legionella. Atypical pneumonias such as Mycoplasma and Legionella pneumophila, they can be managed with clarithromycin or doxycycline. So the drugs will remain the same. Erythema multiforme, Mycoplasma pneumonia. History of exposure to water, hyponatremia, lymphopenia, or staying in a hotel room, Legionella pneumophila. In suspected case of pneumonia, the investigation is chest X-ray. Follow-up investigation is also chest X-ray. And if the person has a history of weight loss and smoker, then we need to rule out malignancy as well. Which patient can be managed at home? The patients who has a curve score of 0 or 1, curve 65 score of 0 or 1, they are low risk patient and they can be managed at home. The first choice is amoxicillin, and if the person is allergic to amoxicillin, then erythromycin, and if he is on statins, then we can give doxycycline. What is the treatment and prophylaxis for pneumocystis jirovecii pneumonia? If an HIV patient has a CD4 count of less than 200, then cotrimoxazole can be used as a prophylaxis for pneumocystis jirovecii pneumonia. And if the person CD4 count is less than 50, then azithromycin is used against prophylaxis of Mycobacterium avium. These 2 points are important. Which drug is used for the prophylaxis of pneumocystis jirovecii? That is cotrimoxazole. So if in the question in the exam they give you a question in which the patient CD4 count is less than 200 and they ask you about which prophylaxis should he receive, then you should select prophylaxis against pneumocystis jirovecii, that is cotrimoxazole. And if the person's CD4 count is less than 50, then he has a risk of developing Mycobacterium avium. And the prophylaxis against Mycobacterium avium is azithromycin. The hints for Streptococcus pneumonia is that herpes labialis, and it causes typical pneumonia, that is productive cough, fever, and lobar consolidation on X-ray. And also it is a diplococcus. So gram staining will reveal a diplococci or gram positive cocci. Again, some point about pneumocystis jirovecii, that it is common in HIV patient if CD4 count is less than 200, and the symptoms is dry cough and desaturation on exercise. This point is important. That's why I'm emphasizing on it again and again. That is desaturation on exercise in an HIV patient. The diagnosis will be pneumocystis jirovecii. Prophylaxis for pneumocystis jirovecii is cotrimoxazole. Hints for Legionella is stay in a hotel room, exposure to water sources, hyponatremia, lymphopenia, and atypical signs and symptoms such as dry cough. So remember these 4 points: hyponatremia, lymphocytopenia, hypoalbuminemia, and elevated liver enzyme. They are the features for Legionella pneumophila. Diagnosis is based on urinary antigen. So mycoplasma and Legionella pneumophila, they both can be diagnosed on the basis of urinary antigen. Erythromycin is used for the treatment, or clarithromycin can also be used. So mycin drugs are used in the treatment of atypical pneumonia such as Legionella and Mycoplasma. Mycoplasma pneumonia, Mycoplasma pneumonia also causes atypical pneumonia, bilateral consolidation on X-ray, and one important point for it is erythema multiforme. Hemolytic anemias can also be associated with mycoplasma because the antibodies that are formed against mycoplasma, they can cause agglutination of RBCs. They are called cold agglutination, cold agglutins because they can agglutinate the RBCs at a lower temperature and they can result in hemolytic anemia and thrombocytopenia. So remember this erythema multiforme and hemolytic anemia, they are associated with mycoplasma pneumonia. Erythromycin or clarithromycin and oxycycline can be used. So for typical pneumonia, our first line is amoxicillin or pomoxiclav, and for atypical pneumonia, clarithromycin or erythromycin, and if they are not suitable, then doxycycline. Now some points about Klebsiella. Klebsiella red or currant jelly sputum. This is one hint towards Klebsiella pneumonia. And the second hint is that it causes pneumonia in alcoholics and diabetics and in old patients. And chest X-ray will reveal cavitation, especially in the upper lobe. Aspiration pneumonia, the organisms that are common in aspiration pneumonia. If someone develop pneumonia due to aspiration of the stomach content, it is streptococcus pneumonia and anaerobes. So streptococcus pneumonia and anaerobes, they are common organism in aspiration pneumonia. So this was all about pneumonia, its different types, and how to diagnose and manage them. So some key points. Remember that bacterial pneumonia in older patients may have non-specific malaise, fatigue, anorexia, and myalgia complaints. So in other words, older patients or geriatric age population, they don't have the specific or typical features of bacterial pneumonia. They will have non-specific malaise, fatigue, anorexia, etc. Streptococcus pneumonia is the most common cause of community-acquired pneumonia, and it is a gram-positive diplococci. Pneumonia in HIV patient, think of pneumocystis jirovecii pneumonia. Mycoplasma pneumonia has a prolonged and gradual onset flu-like symptoms, and that classically precedes a dry cough. Key association that is present in Mycoplasma pneumonia is erythema multiforme. Doxycycline can be used in patients who are penicillin allergic, and clarithromycin cannot be used. Then in those patients we use doxycycline.